Hi everyone, I'm Dr. Lynn Wagner from Wagner Integrative Health, and here's today's Doc's Thoughts. I'm going to spend some time talking about the weight loss drug Semaglutide and Tirzepatide again today. I know that I've done this in the past, but I've recently had some personal backlash, and I've also seen some backlash on social media against doctors who are using this drug. And so I kind of want to talk about the good and the bad and the ugly, and how you should approach this drug if you're thinking about bringing it into your life or into one of your loved ones' life for their health and wellness. So basically, these drugs are drugs that work by managing and improving your glucose and insulin levels in beneficial ways. They also increase level of fullness and gastric emptying and decrease your appetite. And so there's kind of a combination approach with all of those things mentioned that will ultimately make you eat less and deal better with the food that you do eat, and therefore a lot of people do lose weight on these drugs. Now, the problem is that a lot of people are using them off-label. A lot of them are using them inappropriately. And so we're seeing a lot of backlash in the community against people who are doing so. You've seen in Hollywood, a lot of stars are getting super thin using these drugs. And so there's a lot of controversy. Now, these drugs are available both from pharmacies under pharmaceutical brands, but they're also available off-label from pharmacies called compounding pharmacies, where providers like myself can order them and a patient will pay cash to get this drug. The benefit of that is that unless you have a BMI over 30 or are diabetic, you do not qualify for these drugs, period. And even if you do have those qualifications, oftentimes insurance companies are denying these drugs for weight loss and making patients pay upwards of $1,700 a month to use these drugs, which obviously for most people is not something that they can do. So it is a really, really nice way to get them off label to allow a lot more people to have access to these very powerful drugs. Now we'll talk about the bad stuff first. So what we see with these drugs is, first of all, there's a specific type of thyroid cancer that is an absolute contraindication. So you need to work with a provider who is screening you to make sure that you don't have a family history or a personal history of a very specific type of thyroid cancer. The other bad part about it is what we're seeing, specifically more so with the semaglutide, is that patients who lose weight, when they lose this massive amount of weight, are also losing a massive amount of muscle mass. And so specifically in my practice, what we've started doing with patients is that I can't force them to weight train, I can't force them to exercise, but I tell them, if you are not planning on doing a pretty vigorous exercise regimen while taking this medication, you are actually going to be harming yourself. Because as you are losing weight, you are also going to lose muscle mass. And then when you go off that drug and you don't have that metabolically active muscle mass in you, you're gonna be worse off than when you started, even if you're thinner. Ultimately, you probably would gain that weight back. And so that's a really, really important thing to know, that if you're working with a provider and they're not telling you to lift weights and they're not really focusing on that lifestyle piece, you probably should get that advice somewhere else. The other bad thing we're seeing is people pushing it too far. So anytime a patient has control over what they eat, and if they have a history of any type of eating disorder, it can trigger them kind of getting back into that pattern of eating disorder. So specifically someone like an anorexic, if you are able to take a drug that makes you not crave food and not want to eat food, you can end up getting underweight. And so it's really, really important that we as doctors monitor our patients' weight, watch them to make sure their BMI isn't getting too low, and really monitor them for any behaviors that look like they could be spiraling into an eating disorder. So that's something that's naturally going to come along with any type of weight loss drug that you experience. Now let's talk about the good. I will say over and over again that these drugs have probably been the one drug that has changed my practice more than anything else in my career. I have seen patients lose 20, 30, 40, 50 pounds with the use of these medications while also working on changing their lifestyle, and it is incredibly powerful. Obesity and having too much fat is inflammatory. Obesity and having too much fat can lead to other diseases. Obesity and having too much fat can make you feel sluggish, depressed, tired. There's all sorts of things that get packaged together with just carrying that extra weight. And we now have a tool that is allowing us to help our patients change their lives when they tried everything else and it's not working. So there are some really, really beautiful things about these drugs if you use them in a safe and judicious way. And so my whole point of this video is, if you're someone who's thinking about using one of these weight loss drugs or weight loss shots, make sure you're working with a reputable provider who is sourcing it from a reputable pharmacy. Even if it's a compounding pharmacy, that's okay, but make sure it's a reputable pharmacy and make sure that provider knows what they're doing. Make sure that provider has a really solid conversation with you about your lifestyle, what you're eating, how you're sleeping, Are you lifting weights? Are you exercising? What is your plan for getting off of this medication if that's the goal? Or someone who's honest with you and says, you know what, you might be someone who needs to be on this medication for life, and that's okay too, but make sure they know what they're talking about. And then lastly, make sure that if you have any history of disordered eating, it's probably not the right drug for you. Your goal should probably be to focus on the emotions and the habits that lead to overeating and any past trauma that is tied in with that. And maybe it's not time for you to be taking something to help you lose weight until you've dealt with that stuff, and maybe in the future that would be something for you, if that makes sense. So I'd love to hear your questions and your comments. I think that the drugs are getting a lot of mixed reviews and bad press, but there's also firsthand, personally, I've seen some amazing patient experiences with them, and so I would love to hear your thoughts on it as well. Talk to you soon.